Welcome to this series of presentations in which I will address the many issues involved in the association between human behavior and human well-being. I will be approaching this association from a variety of perspectives. While a range of academic disciplines address the issue of human behavior, I will suggest that to gain a full understanding of this association, we should adopt an approach that integrates disciplines. To add historical context to the interdisciplinary approach I will be taking with these presentations, I would like to share with you some of the history of the program in human biology at Stanford University, in which I have been teaching for more than 2 decades. Human biology was founded in 1971 by a team of scholars from a range of academic backgrounds. The academic disciplines represented among the founders of the program included biology, genetics, psychology, sociology, pediatrics, and psychiatry. Human biology's founding in 1971 was greatly facilitated by a grant from the Ford Foundation. At that time, Gordon Harrison of the Ford Foundation described the intent behind the creation of human biology as Stanford's first undergraduate interdisciplinary program of studies. It is a rare sociologist today who has had even one course in biology. It is still rarer for an economist or political scientist. Study of the behavior of people has traditionally been fragmented. Many biologists, meanwhile, have acted as though evolution stopped at the lower primates. As someone trained in both medicine and sociology, it turns out that I am one of those rare sociologists Harrison was referring to. We now know that the founders of human biology were prescient in their approach to learning. Research in the human genome has linked patterns of genetic variation to a range of human behavioral characteristics and health outcomes. The fields of psychology and sociology have repeatedly shown how the psychological environment and the social environment in which one grows up will have powerful effects on the patterns of behavior one adopts. In parallel, a growing body of research has also shown that factors in the social and psychological environment of infants and children can change the way in which genetic information is expressed, leading to measurable differences in neural structure and physiologic functioning that can last a lifetime. It seems an appropriate time to link human behavior to human well-being, and in doing so, do it by integrating a range of academic perspectives regarding the factors that affect behavior. At first glance, it would seem self-evident that human well-being is closely tied to human behavior. In order to improve well-being, logic would suggest that we simply need to change unhealthy behavior. Those who have worked in healthcare and education or in similar fields for which improving well-being is the principal professional goal will tell you that this is often no simple task. It is often intensely frustrating to work with an individual who is engaging in a behavior the direct result of which is harm to that individual's own well-being. Cigarette smoking provides an example. For decades, doctors and smokers alike have known of the direct causal link between smoking, heart disease, lung cancer, and emphysema. And yet, inciting a smoker to quit can be one of the most difficult challenges a physician or other health professional can confront. In 2002, Michael McGinnis and his colleagues at the Robert Wood Johnson Foundation, one of the most influential NGOs that looks at factors affecting human health, published a paper in which they argued for paying increased attention to issues of health promotion through prevention. In summarizing the approach they hoped both researchers and clinicians would take, they argued, behavior patterns represent the single most prominent domain of influence over health prospects in the United States. The daily choices we make with respect to diet, physical activity and sex, the substance abuse and addictions to which we fall prey, our approach to safety, and our coping strategies in confronting stress are all important determinants of health. McGinnis and colleagues suggested that there are 5 principal domains that collectively drive most health outcomes. These include genetics, social circumstances, environmental conditions, behavioral choices, and use of medical care. In 2007, Stephen Schroeder, a professor at the University of California, San Francisco School of Medicine, gave the annual Shattuck Lecture to the Massachusetts Medical Society. In a talk titled, "We Can Do Better, Improving the Health of the American People," he pointed out that among the world's developed countries, the United States ranked 22nd in life expectancy at birth for men and 23rd in life expectancy at birth for women. Building on McGinnis's data, he used the 5 domains described by McGinnis to identify the extent to which they each contributed to the high rate of premature death seen in the U.S. As we will see in more detail in a later presentation, he estimated that 40% of these deaths are directly attributable to patterns of behavior among Americans, chief among them smoking, obesity, and inactivity and alcohol use. As Schroeder went on to argue, the single greatest opportunity to improve health and reduce premature deaths lies in personal behavior. Given the importance, as identified by these and other scholars, of behavior in affecting well-being throughout the life course, it is important for us to explore some of the questions that are central to this association. In upcoming presentations, we will cover topics such as, what is behavior? How does behavior affect well-being? The association between social inequality and well-being? And the issue of how does the neural structure of the human brain affect patterns of behavior a person adopts? Once we have discussed how the brain and its various components develop, we will move on to a discussion of 3 of the central aspects of understanding how people behave. These are cognition, personality, and motivation. This will lead us into a broadly based discussion of how various cultural and social factors in the environment in which an individual grows up and lives can affect patterns of behavior. We will then focus in on a key aspect of human behavior, one about which we have recently developed a tremendous amount of new information: how social inequality and associated stressful childhood experiences can affect motivation, behavior, and well-being throughout the life course. In closing this lecture, I'd like to go back to the fundamental association we are considering, the ways in which human behavior affects human well-being. Before watching other presentations in this series, I would like you to take a moment to consider the following question. How would you define the concept of behavior? Without consulting Wikipedia, a dictionary, or other reference sources, I would like you to write down a 2 to 3 sentence definition of what you understand behavior to be. I will then ask you to post your response on the course discussion page and to read the responses of your classmates, and then to reply to those responses that you find most interesting. We will then also be discussing these issues in class.